welcome back to the deep dive. Our mission here is to take a stack of sources, the curriculum, revision notes, all of it, and just give you that ultimate shortcut to being well-informed.
And today, we are going deep on IGCSE physical education.
Specifically, joints and movement visualization.
Right. We're targeting maximum efficiency here because marks in this section really require two things. First, razor-sharp, precise terminology.
Okay.
And second, you need the ability to instantly visualize the structure you're describing. So we're not just reading definitions.
Well,
We are building a mental 3D model of your own anatomy, making sure the function, the parts, the movement terms, they're all locked into your memory.
deep and fast. We respect your study time. And we know this content carries some really heavy exam weight,
It really does.
especially when you have to explain how these joints work during specific sports.
Bruh.
So we've organized this into 3 sections. We'll start broad with the 3 tiers of joint classification. Then we'll spend most of our time on part 2, inside the synovial joint. That's where all the high mark anatomy lives.
That's the crucial bit.
And finally, we'll finish up with an interactive session. We're calling it the movement workout to really nail that terminology.
Perfect, because understanding human movement, it all starts right here. If you know how the engine, the joints are put together, you can analyze performance, understand injuries.
And the biomechanics of basically any sport.
Exactly.
Okay, let's unpack this. Part 1, the 3 tiers of joints.
Right.
So when we're classifying joints, there's one simple governing principle. It's all based on the degree of movement the joint allows.
That's it. It's a clean scale from 0 movement all the way to total freedom.
So at that 0 end of the scale, what do we have?
We've got the most rigid structures, the fibrous joints. They're also called fixed or immovable joints.
Fixed, immovable. That says it all.
By definition, there is absolutely no movement happening between the bones.
Okay, so think of it like metal that's been welded together. That's the feeling. The essential example you have to know is the structure of the cranium.
The skull, yeah.
The fused joints in your skull. Their function is just absolute protection.
Not mobility.
Not at all.
So one step down from that, we get to the cartilaginous joints.
Okay, so a bit more give.
A little bit. As the name suggests, cartilage is involved, and they are classified as slightly movable.
So they're less like a mover and more like a spacer.
A compressible spacer.
Yeah.
Or think of them as internal shock absorbers.
I like that.
You only get a small amount of movement, but that little bit is absolutely critical for stability and for cushioning.
And the classic example here is the joints between your vertebrae, the individual bones stacked up in your spine.
Yeah.
That slight flex is what lets you bend and absorb impact.
Without it, the whole thing would be too rigid.
Exactly.
And that brings us to the main event, really. The structure of sporting excellence. The synovial joints.
These are the freely movable joints. They offer the greatest range of movement. This is the well-oiled machine we really need to focus on.
And within this category, you get all the variety you need for sports.
Right. So on one hand, you've got the hinge joints.
Like your knee or your elbow.
Exactly. They work like a door hinge, moving pretty much in one direction, one plane. Flexion and extension.
So great for stable, repetitive stuff like running.
Running, rowing, yeah.
But then you have the other type, the really dynamic ball and socket joints.
Oh, the hip and the shoulder.
Yeah. Their structure allows for movement in almost every direction. It's multi-axial.
So if you're analyzing a javelin throw or a discus spin,
Or a figure skater, anything with complex rotation, you are looking at the freedom provided by that ball and socket joint.
that freedom is the key. So we've gone from the static cranium to the full rotation of the shoulder. But to really get the exam questions, we need to know why the synovial joint moves so freely.
Which takes us right into part 2, inside the synovial joint.
And this is where it gets really interesting, because these anatomical details, they're often worth 3, sometimes 4 marks for just getting the definition right.
Absolutely. To understand why a knee or a shoulder works for years, we need to look at what provides the stability, the smoothness, and the protection.
Let's start with what keeps the friction low. We are looking inside a knee joint right now.
Okay.
You know that feeling when you stand up quickly after sitting for a while? That momentary stiffness?
Yeah.
That's your synovial system needing to warm up. The machine oil of the body is the synovial fluid.
That is the perfect analogy. Synovial fluid is the lubricating fluid. Its #1 job is to dramatically reduce friction between the bones.
To stop that grinding.
To stop the grinding. But it has a second role, don't forget this. It also nourishes the cartilage.
And the structure that actually makes this fluid is the synovial membrane.
Hmm.
It's this thin tissue that lines the joint capsule, and its specific job is just to secrete that fluid.
It's the little factory that keeps the machine oiled.
Exactly.
And what it's oiling, what it's nourishing, is the cartilage. This is that smooth protective layer that covers the ends of the bones.
Okay, so its function is,
It has a few. It provides a low-friction surface for movement, and critically, it acts to absorb shock and prevent wear and tear.
so in a high-impact sport, say rugby or long-distance running, is that why older athletes get joint problems? That cartilage wears down?
Precisely. That prolonged, repetitive impact can just erode that smooth layer faster than the body can repair it. And that leads to the bone-on-bone friction that the fluid and cartilage were designed to prevent.
Wow. It just shows how critical that thin layer is.
It really is.
Now let's tackle a huge exam trip-up, where students are constantly mixing up two vital structures. We need to define ligaments.
Ah, yes.
But I think for clarity, we should first say what they are not.
That is a great point. They're always confused with tendons.
Always.
A tendon connects muscle to bone.
Okay.
Muscle to bone. It's what transmits the force from the muscle to actually create movement.
So the focus here for joints and the structure you need to define is the ligament
Right. Ligaments are these tough, elastic bands of tissue.
that connect bone to bone.
Bone to bone. That's the key phrase.
And what's their main role?
They are the ultimate reinforcement system. Ligaments are absolutely vital for reinforcing the joint and providing stability. They limit the range of movement.
So when an athlete tears their ACL,
That's the anterior cruciate ligament. It's been twisted too far, beyond its limit, and that ligament is what gets stressed and tears. They dictate the structural integrity.
wow. Okay, speaking of integrity, let's wrap up the anatomy with the final protective layer.
The joint capsule.
This is the tough, fibrous outer layer. It basically encases the entire joint.
Yeah, it holds everything in the fluid, the cartilage, and it provides that general stability to the whole structure.
So if we put that all together,
The capsule is the general container. The ligaments are the specific cables stopping unwanted movement.
and the fluid and cartilage.
They just make sure all the movement that is allowed is smooth and painless.
And mastering those 5 definitions, fluid, membrane, cartilage, ligaments, capsule, that's how you master the high mark questions.
100%.
Excellent. So now we know what a joint is built of. It's time to test how it moves. Let's get into part 3, the movement workout.
Right, time to get active.
You really need to connect the terms to physical action. So we're encouraging you. Stand up, or at least mimic these movements with us. That physical connection is the best memorization cue.
Let's start with the classic pairing that you see at hinge joints, like the elbow or knee. Flexion versus extension.
Okay, let's do it. Bend your elbow. Flexion is defined as decreasing the angle at a joint. So picture yourself doing a bicep curl. You're bringing your forearm closer to your upper arm, making that angle smaller.
Now straighten the elbow out. Extension is the reverse, increasing the angle at the joint.
Okay.
Straightening your leg fully to kick a ball, that's extension at the knee. You're moving toward a straight line, increasing the angle.
Simple enough. Next up, let's look at movement relative to the center line of the body. Abduction versus adduction.
Right, often at the shoulder or hip.
Yeah, so start by raising your arm straight out to the side, parallel to the floor.
That movement, taking the limb away from the midline of the body, is abduction.
You're taking it away.
Abducting it. And here's the little memory trick you need.
Adduction is moving the limb towards the midline. You are literally adding the limb back to the core of your body.
So lower that arm back down to your side. That's adduction.
So if you get stuck, just remember, abduction takes it away.
And adduction adds it back.
Perfect.
And finally, a quick one, rotation. It's just movement around a central axis, a turning movement.
Simplest example is turning your head side to side.
Or rotating your whole arm at that ball and socket shoulder joint.
Okay, now we have to slow down. We've come to the most common exam trap.
The ankle special.
The ankle special. We need to be so precise about plantar flexion and dorsiflexion because they sort of defy the normal rules.
They do. Let's look at your ankle joint. Usually, flexion means decreasing the angle,
But not here.
but the ankle is described differently.
Okay, let's start with plantar flexion. This is pointing your toes downward.
Like you're planting your foot into the ground.
Right. And here's the tricky bit. This movement actually increases the angle at the back of the ankle.
The visual example is just standing up on your tiptoes. That is plantar flexion.
Ah,
It's the movement you use constantly in running and jumping to propel yourself forward.
got it. And the reverse is dorsiflexion.
Yeah. This is pulling your toes upwards towards your shin.
And if you look at your foot when you do that, this movement physically decreases the angle at the ankle joint.
In an exam, if you're asked about a vertical jump, you have to use the terms plantar flexion and dorsiflexion.
Not just flexion and extension.
No.
No.
You will not get the marks. This is a guaranteed point score if you get it right.
Fantastic. We've covered a massive amount of ground. We locked in the 3 tiers: fixed fibrous, slightly movable cartilaginous, and freely movable synovial. We spent that crucial time inside the synovial joint: ligaments for bone-to-bone connection, cartilage for shock absorption, synovial fluid for low friction.
And we just wrapped up the movement workout.
Flexion, extension, abduction, adduction, and those critical ankle terms. So what does this all mean for the big picture?
It means you now understand the fundamental strengths and limitations of the human body. When you analyze a top athlete, you can see it.
How so?
Well, the explosive power of a sprinter relies so heavily on the stable, single-plane hinge joint of the knee,
Right.
whereas a gymnast needs that maximum multi-directional range of motion from the ball and socket joints in their hips and shoulders to do all those complex tumbles.
So the anatomy literally dictates the sport.
It dictates the sport.
Exactly. Knowing the function helps you understand the application. And that brings us to a final provocative thought for you to think about. If we know that ligaments in the joint capsule are what define the movement limits of a joint, what actually stops the body from moving beyond its intended range? Specifically, think about how those fibrous structures combine with the actual shape of the bones themselves to prevent hyperextension.
That's movement beyond the normal straight position.
Yeah. How essential is that combined mechanical barrier for safety during, maximal effort? That's stability. It's truly everything.
Keep visualizing these structures, keep moving to remember the terms, and just keep studying smarter.
We'll catch you on the next deep dive.